So as we get ready for the first NBA games tonight, we are getting a look at what it's like inside the NBA bubble. So let's talk about it. He's the team physician for the Washington Wizards. Dr. Bryan Murtaugh is live with us right now. So you are, Doc, like quite literally living in the closest thing to a bubble we can imagine right now. What's it been like so far?
Well, initially, we all had a 2-day hotel room quarantine, so that took a little bit of getting used to. And then it's just been getting used to the health and safety protocols around the campus. So every day we have to take our temperature and our oxygen saturation, fill out a symptom questionnaire, and that all gets uploaded to a system and to what's called a magic band. We wear that on our wrists. And we scan that magic band as we access different facilities throughout the campus, so the practice facility, leaving our hotel room, etc. And if you don't do those things every day, then you get stopped by security and you can't access different parts of the campus. And then we do coronavirus testing on a daily basis. So all the players and staff have gotten used to those things, and now it's just about playing basketball. Yeah,
well, let's talk about the players, because obviously I know I'm sure a lot of players are just glad to be back at it, playing towards something they've been working for a while. Do you get any sense that the procedure is a bit frustrating for some of those players, or are they just accepting this as part of the price of playing to get back to the court?
No, I think they understand what's going on. We've had a graduated return. Since the league was suspended in March, there's been a lot of communication with the players and educational activities for them with preparation with coming to Orlando. So they understood what they were getting into, and I think they're excited to play. They haven't practiced as a team since March, and this was the first time they were able to do that while they were here in Orlando. So we have a young team, and we're looking forward to starting the season.
I've been down there before. It is an impressive facility because it has the capability of hosting so many different sports. For a long time, they hosted some spring training games as well for Major League Baseball, which brings us to the difference here. We had Major League Baseball start up a week ago where they are actually playing in most of their home ballparks. This is not a contained environment like the NBA is. It seems as though the NBA's approach has been much more methodical. I assume for NBA purposes, it's also much more practical. But when you look at what's happening with Major League Baseball, it certainly is a big difference between the two approaches.
Yeah, there are some differences between baseball and basketball. So in basketball, we're doing the daily testing for coronavirus. And then, as you said, we have the bubble, so we have a contained population. So that makes things a little bit easier. Now with baseball, they're doing, I believe, every other day testing. And, they're not in a bubble, of course. So the players and staff, they go home and into the environment, and that does put you at some increased risk. Now, thinking the differences between basketball and baseball, with baseball, it's maybe not as high of a risk of a sport. They're not as in close contact as within basketball.
Yeah.
So that has to be taken into consideration. And then the infrastructure that would be needed to create a bubble for baseball is of such an enormous magnitude.
Right.
You think of the size of the baseball fields, it's really difficult and challenging to do that.
Yeah. Before I let you go, I'm just curious, because we talk about just the environment for basketball games, and you talk about the fan and just how the players feed off the energy from the crowds, which certainly we're not going to see. Where are you going to be watching these games from?
So there's a place where the medical personnel could sit, and it's across the court from the home team. And so that makes it easy access. If a player gets injured, we're very close to emergency medical services, the physician exam room, x-ray, and those kinds of things that we need available to us.
Well, the good news for Wizards fans and NBA fans in general is that basketball's back, and clearly this is a road to the championship where, at this point, we couldn't predict anything that happens in 2020, so who knows, we may be looking at the team doctor for the NBA champion Washington Wizards in a couple of months. Dr. Bryan Murtaugh, it's good to see you tonight. Thanks for joining us.
Thanks for having me.